Welcome. Coarctation of the aorta is a congenital disease in which the thoracic portion of the aorta has an abnormal constriction. And this is what it means to have an abnormal constriction. A quick recap of the anatomy, and a part that is quite often overlooked, is the location of the PDA. I'm highlighting it on the diagram right now, and you can see that it inserts distal to the great vessels of the head and upper limb. This unique insertion allows us to have a separation in blood supply of the head and the upper limb versus the blood supply of the abdomen and the lower limb. And if you want to demonstrate this on a diagram, you can see that the ductus arteriosus inserts distal to the left subclavian artery, and this allows us to separate the blood supply of being head and upper limb before the ductus, and abdomen and lower limb after the ductus. This will be really important because when we recap the clinical signs of this disease, we can understand what type of coarctation gives us what signs. If the coarctation of the aorta happens before the ductus, like right here, we call this the infantile form. And if it happens after, we call it the adult form of coarctation. A good way I used to remember this is that infantile means in between, and it's in between the ductus and in between the left subclavian. So this is something to keep in mind. Now, the infantile form of the coarctation is really easy to recognize on examination because it will almost always be a newborn kid who collapses 2 to 3 days after they were born. And the reason this collapse happens is that if you go back to the anatomy, this is a preductal coarctation, which means that the PDA inserts after Now, the adult type of coarctation is usually a diagnosis of clinical signs. And really, it's when we say adult type, it's beyond infancy. It's not really adult. It can present in, let's say, a 15-year-old. However, the clinical diagnosis or the clinical image is you have upper limb plus, let's say, head or cerebral hypertension, lower limb dash abdomen, hypotension or claudication. And sometimes it can present with an interscapular murmur. And usually, and this is what's shown on examination, you have inferior rib notching, which is the Rosler's sign. And this is how it looks like. There's notching on the inferior side of the rib, not the superior. And the way this is diagnosed is that it's an incidental finding. That is, people have secondary hypertension. A patient comes into the clinic and you get the readings of the blood pressure and you notice that they're really high. Something that can also happen sometimes is that it's radiofemoral delay. And this happens because, well, there's a coarctation in between the upper limb and the lower limb. So you expect there to be a pulse delay. Something that you can also see, let's say on ECG studies, is you have left ventricular hypertrophy. Again, it's having to push against this resistance. Now, I also mentioned that this condition doesn't present itself in infancy because we have what we call collaterals. And a question commonly asked is, well, between what and what do these vessels collate? And we can demonstrate this on the diagram. So this is our coarctation. Obviously, this is the adult type. So the ligamentum arteriosum would be around here. And this is the left subclavian artery. It sends blood into the inferior mesenteric artery. And then from the inferior mesenteric, you get into the anterior intervertebral artery. And then this artery anastomoses with the posterior intervertebral artery, which come off the thoracic and abdominal aorta. Now, another thing that's really important to note is that the first and second rib, the first and second rib, they are not supplied by the inferior mesenteric artery. They are supplied by the costo-cervical trunk. And this trunk has no connection to the posterior intervertebral arteries. So the first and second ribs are not notched in coarctation. So if you saw the X-ray image again, we'd expect the first rib to notch to be the third rib because the first and second ribs shouldn't notch in coarctation of the aorta. Now, let's kind of sum everything up here. In the adult form of the coarctation, we said it's a clinical diagnosis. Here, it's basically a neonate that's collapsing. In the adult form, you should expect left ventricular hypertrophy. However, in the infantile, if it's not that severe, there should be time to recognize that the right ventricle is hypertrophied. Again, because the right heart has to do the job of the left heart in this condition. And now here we have the story of the collaterals. Thank you.